Welcome everyone to the Board of Health meeting of April 5th, 2021. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the number posted. The conference call number is 1-508-945-10, and the call-in ID is 274-190-148#. Despite our best efforts, if we are unable to provide for real-time access, possible. And could I please remind everybody to mute their phones? *6 will mute you, or mute your microphones, because we're getting some feedback. And *6 will mute and unmute you. Thank you. I'll turn the meeting over to our chairman, John Beckley.
Thank you, Judy. The first thing I'd like to do today, right now, is do a roll call to establish the attendance by Board of Health members. When I call your name, please indicate whether you're on the call. Dr. Noble Hanson.
Present.
Ron Broman. Did I hear Ron there? I see you, Ron. I didn't hear you. Ed Sheehan.
Ron's muted.
Ron, are you muted? Ron, you have to unmute yourself. You can hear me, Judy, correct?
Yes, I can. And Ed answered as well.
Okay, Ed's there. Carol, are you on the call, Carol Boyce?
Yes, I'm here.
Okay, good, and I'm here. Ron, I see Ron's face on the screen, so I know Ron is on the call. We just haven't been able to hear Ron because he's on mute. You should try and unmute yourself, Ron, if you can. And then we have Dr. Richard Edwards on the call, correct?
Yes.
As our alternate?
Yeah, I'm here.
Okay, very good, Dick. Okay, we have an agenda tonight of 5 items. Let's get started with the first one, which is a variance hearing for requirement to upgrade on a failed septic system for David Peterson at 180 Tanglewood Drive. And representing the applicant, I believe, is Bill Litchfield.
Good
Bill?
afternoon, Mr. Chairman, members of the board. Bill Litchfield here on behalf of the applicants, David and Mary Peterson. The request for the variance was, I think, outlined fairly comprehensively in the letter that I presume you have in your file. Mr. and Mrs. Peterson are purchasing this property from Mr. Peterson's family, although it is a traditional purchase, i.e. they're paying for it. But it is a family transaction, and ordinarily, despite that, it would be required that we replace the system. The system is functioning. It is not a danger to public health, but we have a lack of proximity between the SAS and adjusted high groundwater. Under the circumstances, however, Tanglewood in South Chatham, where this property is located, is to be connected to the municipal sewer system within a matter of months. Sometime later this year. So in accordance with section 5.6 of our real estate transfer regulation, which provides that your board may give additional time for connection upon written request at a duly noticed hearing, which this is. I indicated in my letter that I would provide to you an agreement by the Petersons to connect as soon as the sewer lines are extended. And I forwarded that to Judy and Diane earlier today. Mr. and Mrs. Peterson have signed a document, a covenant, as would ordinarily be the case, that they will connect to the municipal sewer system as soon as the mains are constructed and as directed by your board. So given the circumstances, we think, and I trust you will agree, that it would be frankly a waste of money to replace the existing septic system and then to spend more money in 6 or 8 months to connect to the town system. As such, we are seeking a variance, and I'll be happy to answer any questions.
Okay, any board members have any comments or questions for Mr. Litchfield?
This is Richard Edwards. What do we have any assurances that that sewer is actually going to be ready to be connected within the next 6 to 8 months? In one of the other applications, they also indicated that it was a 1E or whatever work to begin in this fall, and they were hoping to be connected within 3 years. It seems that if the leaching field is underwater at high water, that's a very significant problem. And I'd be concerned if the sewer system didn't actually get connected by the summer of 2022. So I wonder if it would be appropriate to have a provision in a variance that said that if the sewer wasn't connected by next summer, the house can't be occupied.
I would, if I could, Mr. Chairman, to respond, or perhaps Judy was going to respond. I'll listen to Judy.
I was just going to say that I don't believe the sewer will be available. They're going to begin construction in the next 6 to 9 months, and it most likely won't be available for 2 years. As far as the system being in groundwater, it is not actually in the groundwater. What the inspector found was that the estimated seasonal high groundwater, what we do is we do an adjustment based on groundwater wells all over Cape Cod, and in a very, very wet year, the system could be in groundwater. I don't believe it is now. The groundwater adjustment in the area was 5.2 feet, so they actually, they added 5.2 feet to where they found groundwater, and that's where it showed that the leaching could be in a very wet year in groundwater. This situation has been here for many years, so I don't know. It just seems crazy to make them put in a new leaching field and then 2 years from now have to install sewer. But it's up to the board to discuss that.
So Judy, this is John. So is
Yep.
it safe to assume that a mistake was made in 1985 in setting the initial elevation of the system or not?
I think what was happening back then is that they probably dug a test hole and didn't find any groundwater, and then they just put these deep pits in there, 6 feet deep usually, and they didn't do a lot of adjustments back then. Things were a little bit more loosey-goosey, so to speak, and I mean, for the time it was put in correctly. But nowadays we wouldn't let a pit go in that deep nowadays.
Judy, this is John again. Are there things that might be doable now that would, to some degree, help protect the groundwater quality? For instance, I'm thinking, is there a way to add sand to the bottom of the pits so that you had more elevation for the effluent to pass through to filter? Or conversely, are there things that could be done in the house to reduce the flow of wastewater out to the system, such as requiring 1 gallon flow toilets, reduced flow shower heads, things such as that would overall reduce to as low as possible the volume of wastewater going out. Are those things that you think might help? Or?
Sure, I actually have seen other engineers make suggestions to fill the leach pits with sand, for like 2 foot of sand, and a 6 foot would still give you a 4 foot leach pit. That could, and then you would have that extra sand filtration underneath the pit, above the groundwater. It's only in a very wet year, it would only be, less than 6 inches under the groundwater. So if you added 2 feet, you'd be protecting, you'd have that separation that we asked for. We require a foot of 4 foot separation, but Title V requires just a separation. They just, I mean, it can be 3 inches above groundwater and it passes Title V.
Okay.
So that's not a bad suggestion if the board is uneasy with this, to ask them to fill the pit in 1 to 2 feet of clean septic sand.
What do other board members think?
Well, this is Noble. I think the inspection showed that the distribution box failed, and Judy had made the suggestion that the distribution box would be replaced if we granted a variance. And is that something the applicant is willing to do?
If I could respond, Mr. Chairman, Bill Litchfield, yes, we recognize the D box needs replacement, which of course is unheard of with a septic inspection. Yes, we understand that. And I would simply point out in response to a prior comment that Judy made, we are actually 4.5 feet. Groundwater is currently 4.5 feet below the SAS. So it's really only marginal. In a worst case, would we be 6 inches into it? So currently we're 4.5 feet, where, as Judy said, any separation is all that's required. Last I knew, the Board of Health, at least some months ago, had available flow reducing shower heads out in the lobby. No one's been in the lobby of the office for a year or so, but I think that might also be a reasonable solution.
Other comments from Board of Health members? Questions?
Yeah, this is Ron Broman. Is that place occupied year-round?
Mr. Chairman, Bill Litchfield. Currently, Mr. Peterson's parents are there seasonally. They are legal residents in Florida.
So there's only 2 people most of the time.
Correct.
But Bill,
Okay.
Bill, when they transferred to the new buyers, the new owners, do they intend to live there year-round?
I believe that they do.
Okay.
Oh, okay.
Well, I don't know. What's the pleasure of the board? It seems to me that rather than require a new system or require that they vacate the house, I would prefer to place some additional reasonable low-cost strategies on our motion that would give us a little bit of a better sense of comfort that over the next 2 years, we wouldn't be introducing septic effluent directly into the groundwater. I mean, we had a spring last year. Remember how high the ponds were? I mean, we had a very high seasonal groundwater. So I don't know. I would like us to see us require a couple of additional strategies if the other board members would agree to those. I'm not exactly sure which. Bill Litchfield, do you think your client would be willing to add some sand to the leaching field?
Unfortunately, the client isn't presently with me. I think if we could take incremental steps, such as the repair of the D box, and the flow restricting shower heads, we would be, I think, in the right direction, which you're suggesting. I don't know, frankly, the cost involved of the sand, but I understand your concern. I think, however, under the circumstances, fortunately or not, we haven't had a terribly wet spring, and I don't know that there's going to be. I mean, certainly Judy would have the ability, or any variance that you granted might allow for Judy to monitor the situation. And if we have months of groundwater rising, the board could revisit it. It's just that I think we all understand that the expense of a new system, followed by the relatively soon need of a further expense of connecting it, might be an undue burden.
How many bathrooms are in the building or in the house, Bill?
I do not know the number of bathrooms. I'm guessing from looking at the plan, there are two, but the plans aren't always, 100% correct, but there appear to be two.
Judy, would it make sense to upgrade the toilets if they're not currently 1 gallon flush units?
I don't think that, yeah, I mean, that would reduce the flow, but I'm not sure that's gonna really help with,
Okay,
significantly with our issues of pollution. You just tend to get just a more concentrated effluent.
okay,
Oh.
that's a fair point. So Judy, do you think adding the sand would make sense?
I think that, I was trying to look at the sketch here. I think there's 2 pits. Let me just quickly. There are 2 pits. So, yeah, they would have to add, assuming they're both about the same elevation. One of them did have some effluent in it. The other one was dry, I believe. So, yeah, I think that adding sand could be a workable solution. They may need to get, a referral from an opinion from an installer to see how feasible it is to open these and do that easily. It shouldn't be a big problem. They were checked by the inspector, so if he was able to get at them, then an installer should be able to do this easy enough.
Well,
This is Noble. Judy, do you have the ability to do ongoing inspections of the groundwater level in that area?
Yes, I could do that. Yep, I could monitor it, every month or so. I would have to check the maps that we have access to.
Yeah.
The groundwater monitoring wells.
Yeah, this is Noble again. So if thinking along John's idea of the need to add the sand, if we were pursuing that, then we would have to sort of let the applicant get some more information from an engineer and then revisit the thing in a period of time.
I don't think we need an engineer.
Well, whatever, you
We
need
need a septic contractor,
Yeah,
installation contractor to scope it.
Does that sound reasonable?
It does to me.
And to Mr. Litchfield?
We appreciate the board's indulgence in anything, because obviously we're trying to avoid, for a first-time home buyer, we're trying to avoid a double significant expense, and anything that reduces that is an improvement.
Right.
This is Richard Edwards again. I would agree that I think if we can at least meet the minimum requirements of Title V and have the base of the leach field at least at or slightly above high water, given all the high water we've had in the last couple of years, that would be reassuring.
Yeah, there's no,
So I think
because we've certainly given a variance of a couple of years before renewing upgrading a system if the sewering was coming. You know, if it gets to be 5 years, we haven't done it, but 2 years we have made those.
Right.
So it might get us there.
That's what I was gonna say, if we could ask them to add, say, 2 feet of sand in each pit, replace the D box, and then give them a 2-year extension, and then if we have to, we can revisit it in 2 years.
I like that. I think that's
That sounds
reasonable.
fair. Yeah, that sounds reasonable.
Now, so is that something we would order today, or do we give the applicant a chance to see if that's acceptable, or
I would,
just
I would,
order it?
I would think we just pass the motion.
Okay.
Unless there's a major reason why accessing the pits and adding sand would present a special dilemma.
Yeah, that's what the contractor would tell us. Or
Mhm.
have some kind of a provision in there that they could come back. I don't know.
So why don't we come up with a motion to implement what Judy just said, a motion that would include replacement of the D box, adding additional 2 feet of clean septic sand to each of the pits, coupled with a 2-year extension.
Uh,
And the low flow shower heads, some minor thing, I guess.
I guess, based upon what Judy said, the volumes just changes the concentration. I'd leave those off.
Okay.
I would just do the D box, the sand, and the 2-year extension.
So move on that motion. Ron Broman.
Okay, Ron, do we have a second?
Noble second.
A noble second. Okay, any comments from the public before we vote as a board? Okay, then when I call your name, please, is there any conditions we don't have to add anything, Judy, right? Because we just specified them in the motion, so.
Correct.
All right, so when I call your
What
name,
about the connect within 180 days?
well, that's true. And that the connection be,
Be a condition.
that the house, a connection to the newly installed septic system be completed within 180 days of notification. Good.
Great.
Okay, when I call your name, please indicate how you vote on that amended motion. Dr. Noble Hanson,
Approve the amended motion.
Ron Broman,
Approve.
Ed Sheehan, Ed? Ed, you there? You gotta unmute your connection, Ed. Carol
Star
Boy,
6 to unmute, Ed.
all right, Carol Boyce,
Approve.
and I vote to approve. So we've got 4 votes to approve. So the motion carries. Ed, keep working on getting your phone or your computer off to mute so we can hear from you.
Thank you very much, Mr. Chairman, members of the board.
Okay, you're very welcome, Bill. All right, that's issue number 1. All right, let's go to issue number 2 on the agenda, which is a variance hearing and approval of IA Technology for Andrew and Jane Abu at 49 Patterson Road. And I think we've got Thad Eldridge. Are you on the call representing the applicant?
Yes, I am. Thad Eldridge of East Southeast. If we're
Okay.
in luck, my screen has popped up. So the
All right.
Abus own the home at 49 Patterson. They're proposing to expand it and go from 2 bedrooms to 3 bedrooms. The existing septic system has a few variances. It's too close to the building. It's because somebody to the southeast had a well. The town records indicate that they don't have a well any longer, so we can put the system on the east side of the lot. We're proposing as conforming a system as possible. Going from the 2 to the 3 bedrooms, we're proposing a microfast system in it in accordance with the nitrogen loading regulation. And there is a shelf being proposed inside so that we only have to meet a 10-foot setback to the foundation. If there are any questions, I'm happy to answer them.
Okay, board members, any questions or comments for Thad?
This is Noble for Judy, I guess. It also, the proposal would have no reserve area. Is that something that we have granted before? Is there a precedent for that?
Yes, we kind of routinely do that, especially when you're looking at basically an upgrade on these very small lots. There isn't a lot of room for a reserve area. They're essentially using the reserve area to put the new system in. So, and if they ever did have to rebuild the system, most likely they would just put it back in the same place as the existing one.
Right. We have a list in Judy's memorandum to the board members of 9 conditions that she would recommend be appended to any motion we may make to approve. They are upgrading the quality of the effluent with the microfast system. I'm perfectly fine with this. I don't know if any board members have other concerns they want to express. This is pretty straightforward in my mind.
Ron Bowman, I don't have any problem with it.
I'm fine with it.
All right, why don't we get a motion to approve on the table?
This is Noble, a motion to approve the application for the microfast system and going from 2 to 3 bedrooms with Judy reading the conditions for us.
Okay, do we have a second to that motion?
I'll
Ron
second.
Bowman.
Okay, Carol seconds. Judy, would you do the honors and read the conditions into the record?
Sure. Condition 1, the applicant should restrict the property to a maximum of 3 bedrooms and record the restriction on the deed at the Barnstable County Registry of Deeds. Number 2, throughout the life of the system shall be under an operation and maintenance agreement, and this agreement shall be at least 1 year and may be with any mass certified operator of the appropriate grade that has received training by the company on the operation of this system. Number 3, the effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October, and shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standards of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made of the operator by the operator within 30 days. Number 4, after the required 2 years testing, application can be made by the board for review and possible modification of the monitoring requirements. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham through its Board of Health and/or Board of Water Sewer Commissioners directs the connection of this property to the municipal sewer when it becomes available. And this covenant shall be recorded at the Barnstable County Registry of Deeds. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all landscaped areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineered site plan is allowed without further review by the Board of Health or its agent, and this variance would be granted pursuant to Title V and State Environmental Code Title V and the Town of Chatham subsurface sewage regulations is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Okay, thank you, Judy. Before we call the vote, is there anyone from the public who wishes to comment on this proposal or this motion? Okay, hearing none. When I call your name, please indicate how you vote on the motion that's on the table. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan, do we see Ed's name on the attendee list, Judy?
I think his phone number is 432-5987, and it shows him as being muted.
All right, so he's on a phone.
I believe so, yes.
So
So-
what does he have to do to unmute his phone? Is it *6?
*6.
Okay, Ed, if you can hear that, try hitting *6 on your phone. Carol Boyce, how do you vote on the motion?
Approve.
And I vote to approve. So we've got 4 votes to approve. So the motion carries, and you're good to go, Thad.
Great, thank you.
Okay, you're welcome.
All right.
Moving along, let's go to issue 3, which is another variance hearing for Eugene Farber, trustee of the Algene Nominee Trust. And the location of the property is 144 Chat Harbor Lane. This application is also supported by Thad Eldridge. Thad, you want to add some comments to this?
Sure, I'll jump right in. So Thad Eldridge, East Southeast, representing Eugene Farber and Harvey Ross. And this was before the Board of Health a few weeks ago. There's an existing septic system that's too close to groundwater. It's also within 50 feet of an isolated wetland. And the proposal is to upgrade the leaching while keeping the same septic tank. The lot is 5 acres in size, 4.5, 5, depending on how much sand they put in with the nourishment project. The upland area on the property is over 100,000 square feet. And we're not looking for a nitrogen loading variance. This one, we're strictly looking for dimensional variance. We're able to meet the state requirements of 25 and 50, but we can't meet the town requirements of 50 and 100 unless we were to put the septic system back on the property. Putting it back here, we can be outside the 100. This property was scrutinized this past year. We attempted to permit a house back there, and it met with quite a bit of opposition. So we were trying to avoid taking out the trees that would be necessary to take out in order to put a system in the back. And we were looking at maintaining or constructing a system within the already disturbed portion of the lot. So the proposal is to utilize that existing line, the existing septic tank, completely abandon the leaching pit that's on the neighboring property, pull a new line that comes over to a new distribution box with a low profile septic system or leaching field. And it'll require the slight modification of the floodplain. That's been modified before because the driveway is right there. We are going to the Conservation Commission at their next meeting in a week and a half. And if you have any questions, I'd be happy to answer them.
Okay, board members, have any questions or comments for Thad? I don't know who else drove down there. This was kind of hard to find.
It's a great spot once you find it, though.
Yes, it is.
Yep, this is Noble. So, yeah, I drove down there as well. The area that's north, which is the alternative, is that the area that's marked off about halfway out the drive with all the trees marked with red or yellow tape? It looks like that's what would have to come down to use that area.
So that's flagging from the proposal that we had made before. So that would be
Unrelated.
all closer to the driveway. If you were to go through the woods to a bit of upland in the back, it's that's what we'd be looking at. So there's a nice path that goes through there. There's a nice area to walk through. But it's not directly accessible by machine at this point.
So we're really talking about a question of avoiding a long pump system up the hill
Yes,
and trying to locate and keep the upgraded system closer to the existing house and the existing driveway
and within the disturbed area of the lot.
and within the disturbed area of the lot. And in order for that to be approved, we would need to have a Board of Health approval or variance to site the existing septic system, which is already there, 38 feet from the top of the coastal bank. And the leaching area would be 51 feet from the coastal bank, 71 to another one when that doesn't quite meet that standard.
Correct.
Okay. I think it's logical what you put together for the board. I'm personally okay with it, but I don't know about others.
This is Noble. Again, I'd ask Judy for some perspective. So the leaching area offset from the coastal bank, the variance that they're requesting, and the septic tank variance from the coastal bank, have we given those kinds of variances in the past as a precedent?
Yes, for upgrades to existing dwellings. It wouldn't be something we would usually consider if it was new construction, but since this is an existing dwelling, and I did want to note that, I don't know if Thad mentioned that the existing leach pit, if you can see it over on the western part of the plan, is actually on the neighbor's property. So that's another reason why it needs to be upgraded. But yes, we would give this type of variance. I mean, usually you're talking about a much smaller constrained lot. But seeing as, this would cause a lot of disruption to this pristine wooded area, it kind of makes sense to just put it back in the driveway, which is already available for
Right.
construction.
Right.
Okay, thanks.
Ron Broman, I got a question. Judy, how long before the storage will be up there? It's gonna be quite a while, I think. But
Wow.
Yeah, I don't foresee anything down there for many years.
I didn't think so. Okay.
What kind of pump system would that require? Holy mackerel. All right. Any other comments from Board of Health members? Can I get a motion to approve with the conditions that Judy's memo outlines?
This is Noble. I would make a motion to approve with Judy reading the conditions. To
Can I
approve
get
the variance requested with Judy reading the conditions.
Okay, can I get a second?
Second, Ron Broman.
Ron seconds, okay. Any additional discussion or questions or comments before we vote? Anybody from the public wish to comment on this before the board votes? Hearing none, I'll call the question. Dr. Noblehand? Yes.
John, did you want me to read
Oh,
the
yes.
conditions?
Thank you. Yes, please read the conditions.
The applicant should restrict the property to a maximum of 3 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds and submit a copy of the executed deed to the Board of Health. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. The applicant agrees to abide by the requirements of the Conservation Commission for mitigation and planting as required, and no alteration to the floor plan of the dwelling is allowed without further review by the Board of Health or its agent.
Thank you, Judy. Okay, let's go ahead and call the question. When I call your name, please indicate how you vote on the motion. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan, are you there, Ed? Okay, let's move down to Carol Boyce,
Approve.
and I vote to approve. So there's 4 votes to approve, none to disapprove. So that motion or that variance is approved. Thad, you're good to go on this one too.
Thank you so much.
You're welcome.
Have a great afternoon.
You too. Okay, let's go to item number 4. It's a variance hearing for Maureen and Stephen Haddad at 424 Stage Harbor Road. The engineers are Ryder and Wilcox. Do we have Stephanie Sequin on the line?
Hi, yes, good afternoon, Stephanie Sequin with Ryder and Wilcox.
Okay.
And I'm representing Maureen and Stephen Haddad, who are the owners of the property at 424 Stage Harbor Road. They bought this property last June, I believe. There's an existing 3-bedroom house on it. The septic system is a converted cesspool that has discharges to 2 leaching pits that were installed in 1976. This is all according to information that we found on file at the Board of Health. The Haddads got approval from the Board of Appeals to demolish the existing 3-bedroom house and build a new 3-bedroom house in a slightly different footprint. They had hoped that town sewer might be available here by the time that they were done with the construction. They haven't started construction on the or even demolition of the existing house. But it turns out it's going to be maybe 2 to 3 years before town sewer is extended to this property. And so in order for them to be able to get a building permit, we have come up with a plan for a new Title V septic system. Due to the small lot area, there are several variances that we are requesting. They're listed on the plan and also in the letter that was submitted. The proposed septic tank is approximately 6.6 feet from the property line, where a 10-foot setback is required. So we're requesting a 3.4-foot variance from Title V. The proposed soil absorption system is approximately 11 feet from the proposed foundation, where 20 feet is required. So we're requesting a 9-foot variance, and we are not showing a reserve area. If the system failed in the future, if the system even gets installed, the leaching system would just be replaced in the same location. We dug test holes in the area where the soil absorption system is proposed, and we verified clean sand with a perk rate less than 2 minutes per inch, and we did not encounter any groundwater, so the soil conditions are good. There is a wetland off this property, just a tiny little sliver of the lot falls within the 100-foot buffer, but the proposed, all of the new components are more than 100 feet from that wetland area. So we are requesting those variances to allow the installation of the septic system if it is necessary. The estimated construction schedule puts the building completion at July of 2022. July of 2022, so a little over a year from now. So I have requested those variances to allow the installation of a completely new Title V system. After I did that and submitted all this to the board, I took another look at the information that we had from the health department and realized that there are two potentially perfectly good functioning leaching pits here. And wouldn't it be nice if they could continue to use them for the short amount of time that they're expecting to use them, and have submitted an alternative request to the board and asking for you to consider to allow the homeowner to simply install a new 1,500 gallon septic tank and connect that tank to the existing leaching pits. And that would be conditioned on the requirement that the existing leaching pits be inspected by a DEP approved system inspector to verify that they are still in good condition and that they do provide adequate vertical separation to the groundwater. We haven't done that yet, only because the as-built ties for the leaching pits are a little vague, and so it would take a little bit of work to locate, uncover, and inspect the leaching pits. And I didn't want to go to that trouble and expense if it wasn't something, if the board just absolutely wasn't going to consider it. So I just want to throw that thought out there, and if you would consider allowing that to happen, then we certainly would inspect those pits and make sure that they're functioning, and like I said, providing the vertical separation to the groundwater before going forward with the septic tank installation. And if we went with that scenario, there are a similar set of variances that we would be requesting. And again, though they're listed in the revised letter that I submitted. In this situation, we would request variances to allow the existing soil absorption system or the existing leaching pits to be approximately 9 feet from the foundation where 20 feet is required, so an 11-foot variance. The existing leaching pit is approximately 5 feet from a property line where 10 feet is required, so a 5-foot variance is requested. And the proposed septic tank, which is in the same location as I'm showing on the complete upgrade, is still 6.6 feet from the property line, so a 3.4-foot variance, and still no reserve area provided. So I included the copy of the site plan, the existing floor plans, and the proposed floor plans, so you can see that it is a 3-bedroom house, staying a 3-bedroom house. And I would be happy to answer any questions.
This is John Beckley. Stephanie, how old are those existing seepage pits?
They were installed in 1976. So 45 years old.
45 years old. And is there that significant a cost differential between alternative A and alternative B? Because you still have to do a new septic tank. You still have to do a distribution box. You still have to pay the contractor to uncover and assess the existing pits.
Right. A substantial, I would say less than $10,000.
And okay, less than 10,000.
It's hard to say what's substantial these days.
Yeah. But there's an overall project here to tear down and replace a building,
Mhm.
build a brand new home. Um, I don't know, what do other board members think?
I don't know, those, that's a pretty old there, you know, that's over 40 years,
It's 45.
45 years, yeah, that's a long time.
And you would have to, how would you determine the groundwater, Stephanie?
We could do a hand boring next to, once we've determined the depth of the bottom of the pit, we could do a hand boring next to it.
And you would look, you examine the soil coming up? I mean, would you look at the soil for modeling, or would you actually be looking for water?
We would be looking for water. It would be hard to,
Yeah, without doing a.
hard to see modeling in a hand boring.
That's what I was wondering.
This is Noble. So Judy, the estimate of sewering down that road, Stage Harbor, 2 to 3 years, is that accurate, you think?
Yes, the sewer unfortunately stopped just one lot away that's there now, so, and then they're gonna continue it the rest of the way down Stage Harbor Road. If Bob is on the line, he may be able to, validate the time period, but I'm pretty sure it's 2 to 3 years that they're gonna begin construction.
And then how long between begin construction? So my question is, do we have an
Well,
estimate?
actually,
Yeah,
um,
Bob?
John, it's Bob.
Yes.
Yeah, we're finalizing design for this stretch of road right now. It's taken a little bit longer than usual because we're trying to build a pump station right next to the harbor master's workshop, which is in the floodplain and wetlands and all kinds of confounding issues. But I'd say at this point, we're probably 90% or better done. So the idea is this project would, current schedule has it probably going out to bid either this summer or early fall, with construction to start later this year. And then, probably for the sewer part of it, probably a year construction, maybe less. And then the pump station, probably about a year. So conceivably, we start in the fall of 21, conceivably by the end of the year in 22, we might be ready.
Okay. And how, go ahead.
Oh, yeah, this is Noble. So for Stephanie, what's the estimated completion date of the home? Did you say it would be July 22?
July 22.
So we're looking at maybe 1 year. So my question for Judy would be, if you inspect the leach pits and they pass inspection, I mean, does that mean that they are functioning adequately?
yes. I
Yeah.
mean, if they.
So, and then
if
they
they're
have
not
to
ins-
last another year,
what they would-
so.
Right, what she would do is add the septic tank and then put a distribution box between the two pits. It would get rid of the pit, of the northernmost pit, which is the old cesspool. And it should work fine, as long as it's in good enough shape. And, a couple of years is probably not a big issue, especially since this house has been vacant for several years as well. It's been, it was closed off by the Board of Health. It was condemned.
All right.
Because there was a person living there who had no heat or hot water, so the house was condemned. It's been sitting vacant for several years.
This is that same property.
Yes.
Oh, that's the one, huh?
This is Richard Edward. Correct me if I'm wrong, but if the house isn't going to be inhabitable until July of 22, and Dr. Duncanson said that the sewer is going to be there in the fall of 22, we'd only have to use this system for 6 or 8 months before it could be connected.
That's what I'm hearing too, because they still have to build the house. They have to demo the existing house, build the new
July of
house.
22 is what they said.
That the new house would be complete and ready to occupy in
Right.
July 2022.
Right.
Yeah, so this is Noble. So yeah, it seems to me that the alternate B would be reasonable with that time frame that Dick just mentioned.
Right. And it's possible also that the septic could be available before the house is done.
Yep.
So what we're probably looking at is a narrow window of time to bridge from when the new house is occupied until there's an opportunity to do the connection. And if that's the case, I'm perfectly willing to go with the plan, I guess the plan B, which would be to try and see if you can salvage the use of the existing pits. What do other board members think about this?
Would you have to get somebody in there to examine the pit? Or can you do it, Judy?
Yes. Oh,
No, it's a title, Stephanie has people in her office that are certified Title V inspectors, and they would go out and dig it all up and do a hand boring to check for groundwater and make sure that the pits are in good enough shape to be able to handle the flow.
Yeah, I wouldn't have a problem with it as long as, that pit is okay.
How do we know that if there's adequate separation to the groundwater?
So what they'll do is usually they'll dig down either through the bottom of the pit or next to the pit. And then they will apply an adjustment as like per we were discussing before, which is based on the day that they checked, the day that they do the test, and then they will come up with the estimated seasonal high groundwater. So.
And Judy, that is the way to adjust the timing of when you do your groundwater test to when the normal seasonal high groundwater would occur. True?
On the Cape, we do them year round because we do
Okay.
have this series of groundwater wells that are done by Cape Cod Commission. They're all over Cape Cod, and we have, God, probably 30 years worth of data on these wells. So
Okay.
that's how they can figure out what your seasonal high groundwater would be on a very wet year.
Okay.
So.
All right. Other comments from board members? Questions, comments? Is there a comfort level?
yeah, this is Noble. I'd put forward a motion that we approve the alternative B, which would be installing a new 1,500 gallon septic tank, and that the leaching pits pass inspection and the groundwater level is satisfactory. Yeah,
I'll second that, Ron Broman.
Stephanie.
Yeah, can I just ask that you also grant the option A variances that were requested just in case these leaching pits don't work out, and then we don't have to come back to you.
Okay. This becomes a little bit of a confusing motion because we're going to have to reflect two different sets of variances, true? Or not?
I mean, the numbers are slightly different, and my actual memo to you does not have Stephanie's numbers for the second alternative, the alternative to keep the leach pits. But I think if you take your motion and then say, should this not pass the inspection, then we would approve the variances as requested to install a new leaching system at the property. And also, you would want to add that the system must be connected to the sewer within 180 days of requesting it.
All right, so who wants to
I'm
take?
sure that was clear as mud.
All right, this is Noble. So I have my previous motion, and I would add to it that if the leaching pits fail, that we approve the first motion to replace the entire system, and that we add that they be
With a
hooked up
Title
to.
V, with a new Title V
With the new
design.
Title V, yeah, and then what was the other one was that they be hooked up to the septic system in 180 days if it becomes available, when it becomes available.
Sewer, yep.
Judy,
And Judy would read the conditions.
The property would be deed restricted to 3 bedrooms and recorded at the Barnstable County Register of Deeds. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan, and no alteration of the proposed floor plan of the dwelling without further review by the Board of Health.
Judy, do you have, or Diane, do you have a clear sense of the motion?
I think I do. I can help Diane.
Okay.
Yep.
All right, if other board members do as well, I think I do. Are we ready to vote? I guess the answer is yes. Anybody from the public wish to comment before the Board of Health votes? All right. When I call your name, please indicate how you vote on Noble's. Did we get a second on the motion?
Yeah, I second it, Ron Broman.
Ron Broman seconded it. Okay. So when I call your name, please indicate how you vote on the motion. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan. I must have lost Ed. Carol Boyce.
Approve.
Okay, and I approve. So we have 4 votes to approve. So Stephanie,
Yes.
you're good to go.
Okay, great. Thank you
And,
all very much. I appreciate your patience.
You're very welcome. All right. Moving down the agenda, we're on the last item number 5, which is an update and a discussion of COVID-19 with Dr. Robert Duncanson, Director of Health and Natural Resources. Dr. Bob?
Afternoon, everybody. So, just quickly, and thank you very much for the little bit of a delay there. Gave me time to just check the new 5 o'clock numbers that just came out. So as of 5 o'clock this afternoon, Barnstable County has 12,539 cases of COVID-19. And that was up 107 cases from the previous report, which was on Saturday. There was no report on Sunday because of the Easter holiday. The total number of deaths currently in Barnstable County is 448. In Chatham, we are currently at 309 cases since the pandemic began. Just to put it in a little bit of perspective, in January, we had 115 cases. It dropped substantially to February, where we only had 36 cases. We were hoping that trend was going to continue, but as everybody is aware, there is a new surge going on here on Cape Cod. As a result, our case count in March went up to 43. So far in April, we've had 3 reported cases, and we are currently at 28 deaths since the pandemic began of Chatham residents. Just to put, the surge that's going on in the Cape right now, earlier today, it was reported that of the P1 variant, which is the so-called Brazilian variant, because that's where it was first detected. The Cape currently accounts for about 88% of the P1 cases in the Commonwealth. So clearly, we got a report about 3 weeks ago, the first case of the P1 in Massachusetts. It was in a Barnstable County resident. And since then, the number of P1 variant cases on the Cape has gone up significantly. And, that, as you can expect, that is probably an undercount because not every PCR test that is administered is sent out for genetic sequencing. Only about 10% of those tests are actually sequenced on a statewide basis. A couple of things I just wanted to touch base on, and let me share my screen here and I'll show you the graphs that we usually do. Unfortunately, by the time they get to you guys, some of them are a little old or older because I generally update them on Tuesdays before the Board of Selectmen meeting. But just quickly, here's what our case count looked like as of last Tuesday. And you can see that in March, we were closing in and now we've exceeded the number of cases that we had in February. Our age distribution of cases, and we have definitely noticed a trend towards cases in the younger demographic, basically the 20 to 49-year-olds, and that has continued since last week. When this graph was done, with most of our cases being in those three younger demographics. And then looking at the average daily incident rate, you can see that we had that spike in, December, January, and then a fairly precipitous decline in February. And then in March, we had that upswing again. And we saw a little bit of a drop last week. Chatham was in the yellow zone. You're probably reading the paper that, most towns on the Cape, with the exception of 3, so 12 of the 15 towns on the Cape, as of last Thursday's report, were in either the yellow or the red zone. And the only 3 that weren't were Provincetown, Truro, and Wellfleet. And they were all in the gray zone, which is the lowest category. And then quickly swinging over to vaccinations, and this is the one area where the news continues to be good. And as you can see on this graph, and on here I've now started putting 2 graphs on here. So we have last week's graph as of the 23rd, and then we have, we have 2 weeks ago's graph as of the 23rd, and then last week's graph as of the 30th. These reports come out on Thursdays, but they're based on Tuesday's data. So, they're always a little bit behind, if you will, but you can see there's been a fairly good increase in the number of vaccinations from last week to this week, if you will. We are now at about 99% of folks in the 75-year and up category, either fully or partially vaccinated. In the 65 to 70-year-old demographic, we're at about 84%, which has continued to be good news. And I'm looking at my figure and something's wrong. In the 50 to 64-year-old, we're at about 47%, which is, a fairly substantial increase in the previous week. The 30 to 49-year-old demographic, we're at about 29%. And then the younger demographic, the 20 to 29-year-olds, we're at about 18%. So that was a fairly significant increase for that group compared to previous weeks. And then the youngest demographic, the 0 to 19-year-olds, the state doesn't provide any numbers if there's less than 30 individuals in that range. And, that's not unexpected because the vaccines are not yet approved for anyone under the age of 16. And that younger demographic would not have been eligible to receive the vaccine until really today, unless they met one of the prior categories of 2 or more comorbidities. So as of today, the state opened up vaccine eligibility to those 55 and older. as well as individuals with one or more comorbidity. And the state has updated their guidelines to mirror the CDC guidelines, which did expand the number of medical conditions or comorbidities, medical condition being a much easier phrase for most people. But the state did update and adopt the newer CDC guidelines for what is included now in that group. And I could just run through those quickly so people that may be listening at home will know about it. So cancer, chronic kidney disease, chronic lung disease, dementia, or other neurologic conditions. One of the big changes is now diabetes type 1 and type 2, Down syndrome, heart conditions, HIV infection, immunocompromised state. In other words, they have a weakened immune system, liver disease, overweight and obesity. Before that, it was really just obesity, but now they've updated that to include overweight, pregnancy, sickle cell disease, smoking, either a current or former smoker, solid or blood stem cell transplant, stroke or cerebrovascular disease, as well as substance use disorders. So any people that have those conditions, as well as individuals 55 years in age and older, are now eligible to receive a vaccine.
Bob,
And so,
this is John, isn't hypertension on that list too?
yes, hypertension is on the list under, I believe it's under heart condition.
Okay,
Yes.
thank
Heart
you.
failure, coronary artery disease, cardiomyopathies, or hypertension.
Thank you.
So all those individuals, as well as people 55 years and older, as well as in all the previous categories, are now eligible for vaccine. And hopefully, because we've been saying it for weeks now, hopefully everyone has gone ahead and pre-registered through the state system. And the state will be sending out emails now to people to meet those criteria as well, indicating to them that they are eligible to book an appointment at one of the state's 7 mass vaccination sites. Barnstable County has 3 COVID-19 vaccine clinics this week, starting tomorrow. They have one tomorrow, Wednesday, and Thursday. I will tell you that those are all fully booked. They opened for registration on Friday at noon, and they were all fully booked in about 45 minutes or so. The county will be releasing more clinics for next week. Again, we expect that they will have 2 clinics at Cape Cod Community College. And then next week, we expect that they will have 1 clinic as well at in Orleans. We're anticipating it will be a drive-through clinic at the Orleans DPW, as they did early on for first responders and all, but this one will be open to the public. So like the previous weeks, we expect that information to come out on Thursday and those clinics to open up on registration on Friday. But there'll be more to come as soon as we get that announcement from the state. I will continue to urge people to check CVS and Walgreens. We've directed a number of people to those sites, and people have had very good luck booking appointments there. One of the advantages to booking appointments on those sites is they automatically go ahead and book your second appointment. Unlike some of the other sites where you get your first appointment and then you have to get kind of back in the system, if you will, to get your second appointment. CVS and Walgreens are booking both first and second appointments at the same time. They generally update their systems every day. And I will tell you that Walgreens does theirs at about 7 o'clock in the morning. Although I was online over the weekend and last week, and I did see some new availability that had been posted in the early evening as well. So, that's where we're directing a lot of people. And then we did get word today, Judy and I were on a call with Outer Cape Health Services, who you probably know have been doing our Vaccinations for our homebound residents, we did one a week and a half ago. We have another homebound resident one coming up probably later this week or next week. But this week, we're also doing folks at the Park Place Assisted Living Facility. And last week, with Outer Cape Health and our firefighter EMS folks, we did a clinic at the Chatham Housing Authority. For those folks that have, limited transportation options and whatnot. But today in our call with Outer Cape Health Services, it looks like we are now going to be working with them or able to work with them and setting up some clinics here in Chatham. So we reached out. One area that they've targeted is town employees. So we've reached out to all the town employees, many of whom, met the criteria in some of the earlier groups, and so have already gotten their appointments set up. But if folks haven't, we're going to try to set up a vaccination for town employees, as well as we reached out again to the restaurant community because with Outer Cape Health, it looks like we're going to be able to set up a clinic that is targeted just to the food service industry. Again, to get as many of those folks vaccinated as possible. And this is all part of the Cape Cod Vaccine Collaborative effort that's going on Cape-wide, recognizing that the Cape, has a huge tourist community. We're coming up to summertime and trying to target some of those industries or those organizations, if you will, that are vital to the Cape's tourism economy to get them vaccinated. So in addition to the food service industry, we're also reaching out to the hospitality industry. And, like CBI's being one of the biggest employers in Chatham, we may be able to set up a clinic there, if there's enough demand. So those things are all underway. It's good news. It's coming out of a different allocation, if you will, than what the state, gets their allocation. It is vaccine coming directly from the federal government for some of these outreach efforts. So, that's great news. The vaccine is becoming more and more available. And so clinics are now becoming more easily accessible to people. You don't have to drive necessarily all the way up to, the Heinz Convention Center or Gillette Stadium or something. There's more and more vaccine availability right here on Cape Cod. So with that, unless Judy's got anything further, I'm open to questions.
Judy?
No, I think Bob covered it.
All right, questions and comments from board members?
This is Richard Edwards. Hello?
Yeah, go ahead, Richard.
As you know, they're beginning to see a substantial spike in not only cases, but hospitalizations in younger people in other parts of the country.
Mm-hmm.
And the UK variant appears to not only be more contagious, but also causes symptomatic or severe disease in younger people under the age of 50 who previously thought they were bulletproof and go out and party and everything. And the question is, on the Cape now, we're seeing this surge, the greatest concentration appears in Massachusetts is on the Cape now. Mm-hmm. And it seems to be this P1 variant, the Brazilian variant, but are we seeing some uptick in hospitalizations in young people on the Cape?
There is definitely an uptick in hospitalizations. Hospitalizations tend to lag by about 2 weeks. So we're just now seeing that, but Cape Cod Hospital and Falmouth have definitely seen an uptick in cases. I don't have any specific information on the age demographics of those cases. But as we're seeing in Chatham, as we've seen around the Cape, the disease is definitely hitting that younger group. And so you would think that that would also create an increase in hospitalizations among the same group. But they just report the numbers of patients in the hospitals. They don't necessarily provide the age demographics for those.
It just seems it's critically important to get the message out that if you're under the age of 40, it's not a joke. And there seems to be this idea that you can just go out and party and have a good time. And if you get it, it's like President Trump said, just a bad cold. And there has to be more notification of the public that young people are dying. And
Yep.
young people are getting respiratory disease that they may survive, but may cause long-term consequences.
Mm-hmm.
So the idea that the only important COVID cases are the ones that cause fatality, that was promulgated by Trump, is not sensible. And people really need to go out, and people need to get vaccinated, and young people need to get vaccinated. And it'd be nice if we would stop saying that after you've been vaccinated and have really good immunity, then you can travel and you can go to restaurants and you can stop wearing masks. Because when you tell people that even after their vaccine, you still should not travel or should think twice about going to a restaurant, then more people are going to say, why bother getting vaccinated? It's sort of a moral hazard saying these things.
Yeah, I mean, everybody from the state to the CDC and to the local level, I mean, we're all telling people just because you're fully vaccinated, and we've talked about what that means before, that's 2 weeks after the second dose of either the Pfizer or the Moderna, or 2 weeks after the single shot J&J. You still need to practice social distancing. You still need to wear a mask. You still need to proper hand hygiene. Now, there is more information starting to come out because, the studies have been underway to show that, once you've been fully vaccinated, you're not as capable of being as infectious. You may still harbor the disease, but you may not be as capable of spreading it. But that information is just starting to come out. So the public health message so far has not changed. Wear a mask, social distance, wash your hands, even if you've been fully vaccinated.
Bob, this is Noble.
Yeah.
Is there any information on what percentage of the new cases in Barnstable County are from variants? Have they tested enough to know, have any idea on that?
As I mentioned earlier, for the P1 variant, the vast majority of the cases of that variant that have been detected in the state have been in Barnstable County. There's percentages out there, Noble, but you can imagine when you're only testing a small percent of the number of cases or the number of positives, you have to kind of take them with a grain of salt. It's probably a lot more prevalent than the numbers would indicate, just because, we're not testing every PCR positive result to see whether or not it is a variant.
Yeah. Okay, understood. And I had another quick question. Cape Cod Community College, their vaccination clinics, are they arranging for the second shot, that clinic itself?
What they don't necessarily arrange it right there at the clinic, but you do get a subsequent follow-up email about 2 weeks after you've been to the clinic and gotten your first shot. You should get a follow-up email that says, okay, you can come on such and such a day for your second shot.
So they arrange for your second shot. Good. That's what I wanted to know.
They are. They're not doing it as formally as CVS and Walgreens are, where, when you book your first appointment, you get, as part of the same email, here's your second appointment, day and time kind of thing. But that, the county is definitely doing a better job than they were at the very beginning.
Good. Thank you.
Anyone else? Anyone else have questions for Dr. Duncanson? If not, thank you, Bob, for your update, as usual.
Okay. Stay well, everybody.
All right, thanks. We have one more item of business to complete before we adjourn, and that is a approval of the March 22nd minutes. Everybody should have gotten a copy of those minutes with their packets. Does anyone have any recommended edits or revisions to that document? Hearing none, can I get a motion to approve?
So moved.
Noble, motion to approve minutes?
We have a motion to approve. You have a second? Can I get a second to Noble's motion to approve?
Second, Ron Broman.
Thank you, Ron. Okay, let me call the question. When I call your name, tell me how you vote on approval of the minutes. Dr. Noble Hanson,
Approve?
Ron Broman,
Approve.
is Ed Sheehan on? Carol Boyce,
Approve.
and I vote to approve. So the minutes are approved. Unless anybody has a final issue they want to raise, I would entertain a motion to adjourn.
So moved.
Okay, Ron, a motion to adjourn. If I get a second,
I'll second it.
Carol, on a second. Okay, when I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson,
Approve?
Ron Broman,
Approve.
Carol Boyce,
Approve.
and I vote to approve. So we've completed our meeting for tonight. Thank you, everyone, for your attendance and your interactions. Good night, everyone.